4 staff members at a Steubenville Cancer Center have tested positive for the coronavirus. That's our top story tonight. Thanks for joining us. I'm Rich Pierce.
And I'm Kate Davis. And the Oncology Center remains closed, but in the meantime, local health officials provided an update on the situation. Joining us live now with the latest details is News 9's Gage Goulding. Gage.
Good evening, Rich and Kate. Thank you. This evening, we are learning that 4 staff members here at the Trinity Teramana Cancer Center here in Steubenville have tested positive for COVID-19. Now, during a press conference held via phone this afternoon, we heard from local health officials, hospital administrators, and doctors who provided an update on the situation. On Sunday, UPMC and Trinity Health Systems announced the news of the positive cases and the closure of the facility. Now we're learning more about what led up to the coronavirus spreading among staff members. We know that a UPMC employee of the center began self-isolating on March 13th. The hospital and the county health district learning of a positive result on March 25th. 2 days later, UPMC and Trinity jointly decided to close the medical oncology side of the center. Now all of the staff are in a period of self-quarantine. Allegheny Health Services, which runs the radiation side, also closed for deep cleaning. During the phone conference today, center officials outlined what it would take for the facility to reopen its doors.
The Cancer Center will not reopen if all of the employees are negative or they pass CDC guidelines for length of time afterwards.
Hospital administrators should receive the test results of employees by the end of business Tuesday. During the call, it was stated that the facility could reopen as early as the second week in April. While the center may reopen soon, county health officials say they are anticipating cases to continue to rise, with an end not yet in sight.
Some models say early in May, some models say mid-April. It depends on that flattening of the curve. It really depends on which modeling you look at and what behaviors people are doing. There's too many unknowns. That's why it's a novel virus.
I asked the group of health experts on the call why there was a delay from Wednesday when they received the positive test result until Sunday when they notified the public. Here's the response.
I don't think there was any delay. We had one person away for 2 weeks at home, and whenever it was found that she was positive, there was no delay. The first things are not to notify the media, but to make sure that the patients and staff are safe.
Contact tracing to patients that could have been exposed to the infected employees continues, and testing for COVID-19 will be done when appropriate.
First identification is going to be whether or not somebody has a new symptom that's of concern, and then to provide an appropriate evaluation to determine if testing for COVID-19 is warranted for that individual on a case-by-case basis.
Rich and Kate, when asked if the disease has been contained to the cancer center here, Trinity Health System officials say they are confident that the hospital has not been affected by this specific situation. Reporting live in Steubenville this evening. For News 9, I'm Gage Goulding.